Tanisa Lightsey with South University. I am an FNP student. I have Mr. Lightsey here. We're going to be doing a head-to-toe assessment if he agrees to it.
I agree.
Okay, I've washed my hands. I'm going to wash my hands before and after. Now I'm going to assess his mental status. Tell me your name, date of birth, the date, and the situation here.
Charlie Lightsey, 8/24/87. Today's date's 12/6/2020. Situation is you're doing a head-to-toe assessment on me.
He's alert and oriented ×4. I'm going to look at his general appearance here. We have already documented his vital signs, including his pulse, respirations, blood pressure, O2 sat on room air. His skin, his general appearance, he is dressed, he's well groomed. Hair is evenly distributed. There's no lesions, there's no masses present. Capillary refill is less than 3 seconds. Lips are pink, no cyanosis noted. Now I'm going to move to his head. I'm palpating for areas of tenderness, any depressions, hair distribution, and any scar in here. Any tenderness noted to your head?
No.
I'm going to also look at his face to make sure that it's symmetrical. We're going to be looking at facial cranial nerve number 7. Can you smile for me? Okay. Can you wrinkle your forehead like you're surprised? Now do it like you're mad and puff your cheeks, please. Okay. He was able to do all of those tasks. Cranial nerve number 6 is intact. Next, I'm going to assess the cranial nerve number 5. Any pain, tenderness there?
No.
Okay. Going to check the sensation. Tell me what you feel here.
Sharp, 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 dull, dull.
And we're checking bilaterally, and those were intact. Next, we are going to check his temporal arteries here. Okay. Both are palpable, grade 2 here. Next, we're going to move to his eye, checking his visual acuity with a Snellen chart. Ideally, you would want 20 feet away. I'm going to ask him to read the 20/20 line at the bottom, covering one eye. And this is cranial nerve number 2.
DEFPOTEC.
Okay.
DEFPOTEC.
Okay. I'm going to come to the side here. I'm going to do the wiggle test. Do you see a finger here?
Yes.
How many fingers do you see?
2.
This is checking for peripheral vision.
3.
Okay. And he passed that as well. Next, we're going to do the cardinal gaze. 6 cardinal gaze. And we're also going to be noting for nystagmus. Okay. Follow just the pin light with your eyes. Now follow it in. Okay. No nystagmus noted, and this is checking for ocular motor cranial number 3, number 4 trochlear, and abduction number 6 cranial nerve. All those were intact. No nystagmus was present. We're going to assess the eyes. Conjunctiva is pink. Sclera is white. There is no jaundice or no abnormalities there. Okay, we're going to go to the eyes as well and check the pupil for perla. Pupils are equal, reactive to light, round, light, and accommodation. Do an ophthalmic exam. The light will be off in the room. We're going to be noting the internal structure and the red reflex as well. Okay. Next, we're going to the ears. We will be checking for cranial number 8, the acoustic test, whisper test. I'm gonna clamp one ear off. Tell me the number that you hear in the left ear.
14. 12.
And he passed that. I'm going to also do the Weber and the Ren test. Okay. Checking to see if there's lateralization on either side. Okay, anything?
No, equal on both sides.
Ren test behind the mastoid process. You hear the
I
noise?
can hear.
This is checking for air and bone conduction hearing loss.
I can hear.
Gonna look into the ear, noting the outside, no redness, no edema, and no drainage here. Next, I'm gonna go inside, look into the middle ear. There is wax present, there's a light reflex, and we're looking at the tympanic membrane here. We're also pulling the ear back. Same thing, no redness noted. Okay. Now we're going to move to the nose, which is cranial nerve number 1. If he had his smelling off, we could do the smell test. Now I'm going to look inside his nose here, check the turbinates, make sure it is midline. Okay. No deviated septum, no swollen turbinates there, and no discharge. Okay. I would put on gloves for the mouth. I'm going to look inside his mouth now. Say ah. Okay. I'm looking at the tonsils as well. The mucous membranes are pink, good dentation. And we are looking at cranial nerve number 9, the glossopharyngeal, the vagus, the 10, the uvula was midline, and we're also going to have him stick out his tongue for cranial nerve number 12, and side to side. Okay, and that's the hypoglossal. Okay, next we're going to, and his tonsils were free of exudate and redness. Can you speak for me?
My name is Charlie.
No hoarseness noted. Okay. Next, we're going to go to the carotids. I'm going to feel on one side. And then I'm also going to listen. I'm going to ask the patient to turn his neck and take a deep breath with the bell on my stethoscope. Okay, take a deep breath in and hold it. Okay, no bruits noted. No bruits noted there. Okay, next I'm going to check range of motion here. Go decrease your neck down, hyperextend, side to side. Okay, and now I'm going to put my hand here, and then I want you to push against my hand. Okay, and on the other side, push against my hand. Okay, also going to check the shoulder shrug. That's the accessory cranial nerve here. Okay, cranial nerve 12. We're also going to check the notes, pre-auricle, post-auricle, occipital, submandibular, tonsillar, submantle, and anterior cervical, posterior cervical chain here, and supraclavicular. Lip nodes should not be swollen. They should not be fixed. Okay. Should be freely movable. Next, we are going to look at the thyroid gland. Going to have him dip his neck up. We're going to do the anterior approach. See the Adam's apple here. Any tenderness here?
No.
Okay. If I had a sip of water, I would ask the patient to swallow. Okay. Now I'm going to palpate the axillary, central, lateral, pectoral, and subscapular nodes. is palpable. Shoulders are symmetrical. Okay, now we're going to do some range of motions here. Lift your arms out, in front, up above your head, and around. Okay. Any pain, tenderness, or stiffness?
No.
Okay. Now I'm going to do the elbow range of motion. Other side. Stick them out, and then do supine and pronation. Supine and pronation. Any problems there?
No.
Okay. I'm going to do the break roll. Radial. There are 2 plus here. Bilaterally equal. Tip reflex, tricep, bicep, brachioradialis. The other side. And brachioradialis. We're also going to do the patellar. Go ahead and get him while he's setting up. Okay. Achilles here. You can also do the Babinski sign for the reflex. Go down, straight the foot, all the way up to the group toe. Okay. Did the deep tender reflexes here. Now we are going to listen to assess his strength. Squeeze both my hands bilaterally. Both are bilaterally equal. Go to the chest anteriorly. Okay, we're going to inspect A and P diameter here. There's no increase, which would be in COPD patient. Going to listen up here to the apices. We've got the vesicular, the bronchovesicular. When listen for breath sounds, we're gonna one full inhalation and exhalation when we listen to breath sound. Gonna check for tactile premises. Say 99.
99, 99, 99.
Okay. Come to the back.
99, 99, 99.
Also going to listen for the heart sounds. Aortic, pulmonic, Herb's point, tricuspid, and mitral valve. Chest is symmetrical, contour, no lesions present. Also going to go back here to the back and listen. Deep breath in and out. We're comparing bilaterally each side. Okay. We're also going to percuss back here. Normal lung should be renaissance. Hyperrenaissance could indicate a pneumothorax. Okay. The breast is superb. Now we're going to ask him to lay down on the bed. We'll check his abdomen. There was no adventitious or diminished lung sounds noted. Next, we're going to look at his abdomen. We're going to inspect it first. It is contour, symmetrical, and there's no stria or old surgical scars here. Last bowel movement.
Today.
Okay, I'm going to listen to his bowel sounds here, starting in the right, lower, right upper, left upper, and left lower. We're also going to auscultate the aortic for Bruitt's, the renal on both sides of it, iliac, and the femoral for Bruitt's as well. Next, we're going to do light and deep palpation, and also percussion. Percuss the liver's edge here, liver span, and then we're going to perform the percussion, light, and deep percussion. Okay. Any problems here? Any tenderness?
No.
We're going to Boaz sign and the arbitrator sign. Boaz would be with somebody with acute appendicitis, same as arbitrator. We're going to lift up. He should have pain while placing resistance to the leg here. Okay. Do you have pain in the right lower quadrant?
No.
Arbitrator, get him to roll over to the left side. Kind of do his leg and then flex it back. And if it was positive, he would have the pain in the right lower abdomen. Okay, you can flip back. And also percuss the spleen as well. Okay, next we're going to go to the urinary. I'm going to palpate his bladder here. Any problems here?
No.
Okay. Any urinary changes?
No.
We will do CVA tenderness when he sits up. Next, we're going to go to the hip, looking at the for any deformity, any tenderness. We're looking at the greater trochanter, ischial. Any pain here?
No.
We're going to do some range of motion exercises. Lift this up, out. Okay. Going to bend your leg up. We can also test for the drawer sign, the ACL. Any problems there?
No.
Do the same thing to the other side. Bend your leg up, out. Flex it up. Okay. Okay. And there's no edema to this side as well. Okay. Next, we're going to go to the knees. There's no edema present here. We did a drawer test. There's no edema noted to the shins. We are doing assessing the strength to both legs. Push down like a gas pedal. Pull up. Strength is bilaterally equal. Check the pulses. Femoral up here. Popliteal, pedal, and the dorsalis pedis back here. Okay, they're both bilaterally equal and grade 2. Okay. Next, can you tell me if it's sharp or dull?
Sharp. Sharp. Dull. Dull.
Okay. We did the sensation test as well, and we assessed strength. Okay. You can set up. We've already checked his deep tender reflex. I'm going to give him an object to see if he can identify. Close your eyes, please. Okay. What does that feel like?
Pen.
Okay. He was able to identify that. Now I'm going to get him to stand up. We're going to stick our hands out. Touch our nose. Touch our nose with the other side. Okay. We're going to do the pronator drift. Stick your arms out. Turn them up. Eyes closed. And we're going to see if the patient drifts to one side or the other. Next, okay, so you passed that. Next, we're going to do the Romberg. Drop your arms down. Stick your arms out to the side. Arms out to the side. Palms up. Feet together. Eyes closed. And we're going to provide safety here to make sure that the patient does not fall. Okay. Now you can push your arms down. We're going to do a heel to toe walk. Heel to toe, please. Okay. Now we're going to check his spine. So walk up. Okay. I'm going to get him to kind of bend back with your spine like this. Okay. And then I'm going to get you to twist side to side with your, okay, side to side. And I'm going to get you to bend down. No scoliosis noted. You can set up. No lordosis or kyphosis that is present. Thank you for watching my head to toe assessment And thank you, Mr. Lotsey, for being my patient. Thank you.
Thank you.